Hi there, I'm Dr. Rob Mangus, and I've known her for about the past month or so. We got involved after things had already started moving. I think in retrospect, this has been going on for many months. We sort of saw her at the low point, and we're all happy because things are starting to improve, but we still have a long road ahead of us. She has something called acute leukemia. She does have a subtype of that has a better than average prognosis, so we're extremely hopeful. But it is something that has a long road ahead of us, especially over the next 6 months, and even after that in terms of just checking, but intermittent treatment, some of which will require hospitalization, some of which would make her tired even if there are times when she's at home. Certainly we'll try to have as much of it as home as is medically reasonable, still keeping a close eye on her. As part and parcel of this disease, unfortunately it caused problems with clots initially and stroke. Those are all improving, but also side effects from the treatment, including tiredness and, at least for a while, nausea. That seems to be doing better now, and transfusion requirements, and just a lot of visits and a lot of care for the foreseeable future. Any other questions?
So what's my percentage chance of survival with this? Survival.
Normally, with what I would see with this, I would normally quote in the 75 to 80% cure rate. We're still in the process of getting into remission. There are some people that do have relapses later on. This is a type of leukemia where we would never consider bone marrow transplant up front, but sometimes if there is relapse, we have to consider that at a later date. But usually the prognosis is good enough that we can fight it with other medications short of a bone marrow transplant.
So within the last month, with this diagnosis, everything else, I've noticed that most of the days I'm perfectly fine, other than being a little tired, except for chemo week where I feel like throwing up and I think I got pregnant. But I'm assuming that's what I'm going to be expecting for the next 6 months or so. Is that?
Yeah, I mean, I think there's going to be peaks and valleys. Certainly, we do the best that we can to try to prevent nausea. But it's certainly true that young women, on average, will have more nausea from the treatments than an old man will. But we'll continue to work hard on that. Yeah, but it just intermittently, and obviously we work hard, and I'd hope that'd be at least a little better in the future. Still, certainly some risk for that, but we'd work hard to prevent that and fight it if it happens. And then obviously it would fade over a few days, even if it developed. The other thing that I think is that, you know, in terms of cure, that's the other hard part of this, is that we can be encouraged as the year goes by, but we'd have to have several years under our belt to make sure it's cured. Some of that we won't know for quite some time, for sure.
So have I been a pain in the butt patient or an average patient, or?
No, you've been great. You've been a star. Everybody has side effects with this. There's always ups and downs, and everybody's a little bit different with this. But no, it's except for having to wake you up every morning, it's been fine.
Yeah, morning stuff, but that's okay. All right, well, thank you very much,
All right.
and thanks for the recording.